Good evening, ladies and gentlemen. I got Spence here tonight. We're going to go through the trauma kits, the bleed kit, and the AED pack. We'll show you what tools we have, what equipment we have, what we can use and what we can't use, and what level of certification.
Alrighty. First up, we have the AED kit. We have the AED with it, so the pads. Let's open it up. Different things here. Noting that. This kit is strictly for bleeds. We can open it up and just show you briefly. Gauzes, some topical wipes, and inside here, sterile bandages. Again, this is more geared for the first aid. And then this is our trauma kit. So arriving on scene, this would be our combo. If there's any bleeds for us as well, then we have some external uses. Okay, so let's start off with the trauma kits in the front. Alright, so this is the O2 port. This is where you would have access. So with the N95 mask, or with the BVM, or with the nasal cannula, you would have to be O2 certified to use this, and also target responder. The reason why is because oxygen is a drug. It is toxic. All right, this first pouch here on the side. All right, so we have the BVM. We have the manual function, Narcan. We have some N95 masks, and also a C-collar. Again, so this individual, you would be at the head. You'd be working with the breathing. So a part of maintaining the airway is also suctioning. If you're at the head, then the C-collar is also manageable. And again, with the Narcan and with the nasal spray, I believe is the blue one. And again, target responder, that would be that level. So as a first aider, you are not allowed to use the BVM suction. They might let you put a C-collar on, but you are not going to be really doing anything at the head. All right, so now on the opposite side, now this is more geared for the trauma. So again, PPE, masks, gloves, anybody can use those. We have our pen lights here. For the pupils, we have all the variety of the bandages, the cold packs and the hot packs, the tourniquets, sterilized solution with the cool gel, the med stick. Okay, so in this compartment, we'd be more dealing with breaks, like any bleeding, any like trauma. It is at a level of first aid, and the SAM splints, and also the emesis bags, which is for vomiting. And again, this is at the first aider level. However, I would recommend against using the tourniquet unless you are a target responder. More gloves. Okay, so we can stop that there. Okay, so now we're in the main compartments. In this pouch up here, you're going to see a package with OPAs. Again, this is a target responder use. It's meant to keep the airway open. To also gain more compliance with the DVM. Okay, we have the O2 masks, the nasal cannula. Again, like that. Okay, and this is where you find the oxygen. This is the regulator and the key, so you would crack open the bottle and then set your pressures with this key here. So a nasal cannula, for instance, would be attached tube to here, and you would set this between 4 and 6 liters per minute. And again, this is all target responder use. At our current level, we are not allowed to use this compartment whatsoever, including the oxygen. Okay, so also in this compartment we have NRBs, non-rebreather masks. They go on the patients, and what happens is when the patient will expel their CO2, it does not get trapped, so they're not going to be breathing in the CO2 as well. This mask is for the COVID, and the major difference between the traditional NRB and the COVID one is these ports here. Traditionally, when the person would expel, this is where it would come out of this port. Now there is a filtered area, so they're not rebreathing in their CO2. However, the contamination of COVID is not being expelled as well. Okay, so lastly, attached to our kit is our vitals bag. So in here we have a tympanic reader. We have 2 blood pressure cuffs, a stopwatch and watch. We have a pulse oximeter. We have a flashlight. We have a notepad for monitoring like any vitals or a medical history. We have pens. We have 2 pen lights and the stethoscope. For measuring the blood pressure. Again, this is at the first aider level. However, as a target responder, you are going to have more knowledge about the medical background as to why you are actually doing these things, and have a better understanding of what levels are actually normal for that person. Alrighty, so along with our medical bags, we have extra materials and equipment. Back here we have saline, we have water, we also have anything else to clean up, garbage bags. In this bin, it's our burn kit. Okay. Again, more saline and sterile burn bandages. So again, with our trauma kits, you might come to a patient and realize that the burns are a little more severe. So you can bandage them up exterior, bring them in here, and do a more thorough clean. Again, this is a target responder level. This is not necessarily a first aider level. Okay, and then moving on again. We have more blankets, more PPE. So we have the traditional masks that are worn, and we have the N95 masks. Okay, moving on again. More PPE. We have the Narcan and more saline and alcohol swabs, hot and cold packs, goggles and saline. One thing I did miss is again these masks, especially with the COVID. And then lastly, we have our biohazard. So again, these bags can be used for things with blood on them, any needles, or when we get more involved with any type of symptom relief, anything that's used will be disposed of and then taken from the scene. And then up here we have more of our extrication use. This is our basket here. We have the blankets that go with it. And up here as well, extrication collars. This is another bag with the straps in it for the litter basket. And then lastly, there is the KED, all of which are used for extrication purposes. And again, at a target responder level. First aiders just are not taught that. Okay guys, so just again to go over what we are allowed to use right now with our department scope of practice as first aiders. We can use the AED. We can use this kit for bleeds, which is an external case to this. We can use this for vitals. And lastly, is this pouch here. Okay, and that is our scope of practice at this time. Once we are target responders, that opens up this compartment. Again, with his, in terms of the ABCs, that has to do with the breathing. And our O2, which again also includes the N95 masks, the nasal cannula, oxygen, BVM, suctioning, C-collar, Narcan, and other symptom reliefs. So at this time, we are limited to one pouch, our carry-on, and the AED and